The Urology Center of Colorado strives to provide patients with exemplary outpatient urologic care in one convenient location. Featuring a highly trained and caring staff led by board-certified physicians, this state-of-the-art 60,000 square foot facility is the only fully inclusive urology center in the Rocky Mountain region.
One of the main principles was to allow our patients easy access in one convenient location. And easy access means that if you call for an appointment and want to be seen that day, you'll be seen that day. If you want to see a specific doctor, sometimes it'll take 2 or 3 days to get in to see a specific doctor. The second thing that we wanted to accomplish was be able to provide to our patients the most state-of-the-art urologic services. The other goal was to provide a good working atmosphere for our staff, as well as a place where our patients could come and feel comfortable. And that's why we put the center together.
When Jim McCann got the news, he feared he would become just another statistic, a man stricken with and ultimately succumbing to prostate cancer.
When the ensuing biopsy came back positive for cancer, I was stunned because my father had died of prostate cancer in '83. And so I decided I was going to take some positive action to get rid of it.
Jim is not alone. According to the American Cancer Society, prostate cancer is the most common internal cancer found in American men, as well as the second leading cause of cancer death. In fact, nearly 219,000 new cases of prostate cancer will be diagnosed in the United States in 2007.
Once patients get over the age of 50, they need to start getting checked once a year. If they have a family history of prostate cancer, if they have a brother or a father or an uncle or a grandfather with prostate cancer, they need to start getting checked once a year starting at age 40. If they're black, they need to start getting checked at age 40 as well, because we know that African Americans are at increased risk for prostate cancer.
Jim turned to Dr. Heppy and the Urology Center of Colorado for treatment. While Dr. Heppy specializes in the innovative treatment of prostate cancer, each of the supporting board-certified urologists on staff consistently deliver in their respective areas of expertise. The result, high-quality, convenient care for all urologic conditions in one location.
In Jim's case, we went ahead and did the Da Vinci prostatectomy, and he had an excellent result from that. The idea for the Da Vinci robot was originated with the Defense Department and NASA. They wanted a way of operating on patients remotely. So they developed this system where they have a robot that actually holds the instruments, but the physician is remote from the patient. The robot holds the instruments, but the surgeon tells the robot what to do with the instruments. The advantage for the patient is that it's minimally invasive. So instead of having a large incision, it's several very small incisions. So there are a lot of advantages to the patient and advantages to the surgeon. It makes the surgery go much more smoothly, there's much less blood loss, there's greater magnification, so there's less risk of nerve injury, and the patients do much better with the surgery. They recover faster, they're out of the hospital within 24 hours, they only have to have a catheter for 1 week rather than 2 weeks. There are quite a few advantages to the patient to have that operation.
When the patient comes here, not only do they see their doctor, but they get their services and their tests done all at the same time. So it prevents multiple trips back and forth from the hospital or to an X-ray facility to come here. We all work together, and we can therefore send my patients to the person who does the robotics, because I think that's the best approach to the management of surgical treatment for his prostate cancer. We also have the advantages we can subspecialize in other areas such as stone disease, and have people who are experts doing ureteroscopy or people who are an expert in infertility. So it allows us all to practice general urology, but to develop the areas that we're interested in.
Now, after caring treatment and support, Jim's health is back on track, and the fear of becoming a statistic is giving way to a renewed vigor for life.
I had the Da Vinci procedure performed in May of 2005. I was very pleased with the outcome, and I'm very glad I had it done. The Urology Center of Colorado showed me a lot of concern for my well-being and took, it seemed like a personal interest in my feelings and attitude toward the initial procedure and then my curative process along the way.
Contact the Urology Center of Colorado today. educating and creating awareness is the best defense available in the war against cancer.
Most urologic practices, you can practice urology, but you can't do the other services that we offer. And some of the services that we offer are radiology, so we can do your plain x-rays or your CAT scans, and it can be done the day of your appointment. Because it's all electronic, we have it readily available in our clinic. Our laboratory, we're able to do our anatomical pathology on our biopsies right in-house, and we have pathologists who are subspecialized in urologic pathology, and because we're all connected, we have the reports back within 24 hours. If there's anything abnormal, if they're concerned, they can notify us right away. We also have radiation oncology, which most urologic practices don't have. They're usually tied up with a hospital or freestanding.
The Urology Center of Colorado is one of the few centers in the United States that offers a comprehensive radiation oncology treatment for prostate cancer patients, as well as bladder cancer and testicular cancer. We also have one of the unique features in that I am board certified in urology as well as radiation oncology, which is probably one of the only centers that offers that unique feature.
Of course, when I got the news that it was prostate cancer, it was very devastating because my father had passed away from that 13 years earlier. Dr. Karsh and ultimately Dr. Westmacott were very good at explaining the options that I had. They did a great job of painting out those options for me. And as a result, I was able to make, I think, a very educated decision. And my decision was to go with external radiation. I would certainly recommend the Urology Center to others. It's been a very positive experience for me.
And the response has been overwhelming. One, they like the fact that they can come and get everything done in one convenient place. Two is they're seen on time. It's quieter than most offices. And three is they can see their doctor and know that nurse is available to them at any time during the day. So I think the overall satisfaction has been over 90% have been very enthusiastic about what's going on here.
Some of the other areas of expertise that we have at the Urology Center of Colorado include minimally invasive treatment for the treatment of benign enlargement of the prostate. We do a number of microwave therapies here, and that is a minimally invasive treatment for BPH. We also offer up-to-the-date, state-of-the-art technology for treatment of female urinary incontinence, and many of those procedures can be done at our facility. We'd like to see the center grow and continue to be on the cutting edge of both expert urologic care and good technology. I would ultimately think that we would have at least 20 urologists in this group, and that we would represent truly a regional center for urology.
From a brachytherapy standpoint, we offer low-dose rate brachytherapy. We might be able down the line to also offer high-dose rate brachytherapy. We're also looking into an affiliation with medical oncology, and so that from maybe the bladder cancer standpoint, we may be able to look into more bladder-sparing type of treatments with radiation and chemotherapy.
The Urology Center of Colorado is here to provide high-quality urologic care for people in the Rocky Mountain region.